President Bush wants doctors to switch to electronic record keeping. He believes it will reduce medical errors, save lives, and save money. Federal health officials are urging family practice doctors in communities like Newark to apply for grants. NJN News health and medical correspondent Sarah Lee Kessler has the story.
Electronic health records already are kept at many of our nation's hospitals, including most in New Jersey. Now President Bush is pushing for 50% of doctors' offices to make the switch by the year 2014.
There is no doubt that the time has come to connect the entire provider community.
At a meeting in Newark earlier this week, a meeting convened by the U.S. Department of Health and Human Services, Deputy Secretary Tevi Choi explained,
What we're trying to do is set national standards about what you need, what kind of information you need in terms of value.
The department is promoting what it calls interoperable electronic health records. The idea is to reduce medical errors and to connect to better health care.
Electronic health record can all contain your clinical information, contain information about your hospitalization, the medications that you take, allergies, to make sure that the physicians don't prescribe something you're allergic to, any drug reactions you might have had, plus your lab, your x-ray.
Primary care doctors in small to medium-sized practices are being urged to apply for a new Medicare demonstration project that offers individual doctors up to $58,000 over 5 years to go electronic. It'll be a big challenge. Of the 19,000 physicians in New Jersey, an estimated 96% currently don't use electronic record keeping. Many cite costs.
For instance, if I have an electronic medical record and my colleague next door doesn't, we still get the same reimbursement for the same codes.
Other doctors who've embraced the technology, which is privacy protected, say it will potentially save lives.
In our system, once we open the patient's chart, it tells us that this patient has still not had his colonoscopy or a woman hasn't had its mammogram yet.
12 communities will be selected for the demonstration project in June. Sarah Lee Kessler, NJN News, Newark.